Hi everybody, I'm Michele Steiner. I'm the Vice President of Pharmacy. Welcome to Neighborhood. So there's many advantages to having an on-site pharmacy. One of the best advantages is convenience. It's convenient for the patient since we're right in the same building and they can stop and get their prescriptions on the way out from their visit. Another benefit is better access and better care for our patients. We work directly with the providers and we're able to access their medical records to provide more comprehensive care that they probably wouldn't have the same experience somewhere else. Some of the other advantages are it financially benefits both the patients and the organization. We work really hard to make sure that the medications are cost effective for the patient, and it also helps the organization to be financially sustainable and expand some of our other services that we can provide to patients. I'd say two of the biggest things that stand out to our patients about our pharmacy is our caring and passionate pharmacy team as well as our delivery service. Our team really goes above and beyond for the patients. They personally call the patient to let them know when their prescriptions are ready. They will take however much time you need to make sure that you understand, to identify any barriers. They will use language lines. They'll follow up on your prior authorizations to make sure if something's not covered, it doesn't fall off the radar, but that we either get it covered or get you an alternative. So I'd say really our employee team does a great job to go above and beyond for the patients. Anyone. So neighborhood health center pharmacies are open to the public. We are a community retail pharmacy. We do really advertise to our current NHC patients, but we are happy to help anybody. So encourage your family and friends to stop by. Neighborhood Health Center does have a very diverse patient population. Some of the tools that we use to help patients whose preferred language is not English are some bilingual employees. So some members of the pharmacy team speak another language, primarily Spanish and Russian at this point in time. We also frequently use interpreter services via the telephone. So whether you are present in the pharmacy physically or you're on the phone, we will utilize the language lines to make sure that you understand. We address any concerns and that we're not playing charades to try and get a message across. And then we also can print the prescription labels in Spanish and Vietnamese, and we also can provide all of our drug materials and videos about medications and disease states in Spanish as well. Yeah, so as a federally qualified health center, we offer sliding fee scale, which is a reduced fee for services. And that is something that's based on both household or family size as well as household income. And anybody is eligible to apply. It can be used for patients who are both uninsured as well as underinsured to help reduce costs across any of our services. And in order to apply to determine eligibility, you can work with either our billing departments or our pharmacy teams, and they'll work with you to go through the documents that we need to complete, which really assesses your family size as well as your income, and they'll determine right then what your eligibility is and what fee schedule you would be eligible for the next year. And then prescriptions typically cost somewhere between $3 and $9 per prescription per month, and we work really hard to make sure that we get you something that is cost effective but also clinically effective to help whatever we need to treat. Yeah.
Whenever you're ready.
Sliding fee scale is a discount program that we offer to patients based on income and household size, and we encourage every patient to apply. We never want cost to be the barrier to care. And in order to apply, you can work with either our pharmacy team or our billing teams. Whether you're in person or on the phone, we're able to go through all of the questions and documents that we would need. And right in real time, we would determine your eligibility. And once we determine your eligibility, you would be eligible for a 12-month period. And it would help reduce any of your co-payments or just non-covered item prescription costs, and it's typically somewhere between $3 and $9 per prescription per month. So we really want you to apply and help support providing cost-effective medications for you. We know that transportation and getting into the pharmacy can be difficult, especially in these past couple months when we've been getting a lot of snow and some cold. So some of the things that we do to help support making sure that transportation is not a barrier to getting your medications is we offer free delivery of your prescriptions. We offer delivery Monday to Friday, and we'll work with you to identify a time, a day, and a location that works best for you. And we also can work to sync your medications so that we fill all or most of your medications at the same time each month, which can also help to reduce the number of trips to the pharmacy. So if you have trouble getting in, just give us a call and we're happy to coordinate that delivery for you.